Welcome to the fifth lecture in this module, and today we're going to talk about the use of cannabis-based medicine in some psychiatric disorders. Specifically, we're going to talk about the use of cannabis in anxiety, post-traumatic stress disorder, depression, and sleep disorders or insomnia. So why do I need to know this? Why is this important to me? We know that reductions in anxiety and stress and improved mood are frequently reported as the main reasons that chronically ill people use medicinal cannabis, as well as the relief of more serious or more physical symptoms such as pain. Mental health aspects of chronically ill patients are often improved by cannabis-based medicines and also by over-the-counter CBD products. And actually, I've previously told you that the number one reason that people use medicinal cannabis is for pain relief. But very recent survey data, and I'm talking about just in the last year or two, suggests that actually maybe mental health disorders is taking over from pain as the primary reason that people use medicinal cannabis. And this is particularly true because mental health issues, anxiety and depression are becoming a lot more prevalent. And so people are turning to alternative strategies for managing that and self-managing those conditions. The use of cannabis-based medicines, and particularly cannabidiol, in psychiatric conditions is quite an active and up-and-coming area of research, and you'll learn today that actually there's an awful lot of ongoing clinical trial work trying to establish whether or not pure CBD or CBD-rich extracts could be used in the treatment of anxiety disorders and post-traumatic stress disorder. So let's talk first about anxiety disorders, and I'll give a little bit of an overview. They are the most common mental health disorder worldwide. So it is really very prevalent in adults is some form of anxiety disorders, and they can take various forms. So you can have generalized anxiety disorder where you feel anxious about a wide range of situations and issues and it's not related to a specific event. And this affects about 5% of adults. You can have social anxiety disorder where you specifically have trouble in social situations, talking to people and attending social gatherings, and so you tend to avoid situations like that. And then probably the more severe end of the scale is post-traumatic stress disorder. And this is an anxiety disorder which is triggered by a very stressful or frightening event, which the patient then relives over time and generates an anxiety disorder within them. So some of the symptoms of these different types of anxiety disorders have commonality, such as feeling worried and anxious, having trouble concentrating and having trouble sleeping, feeling dizziness and heart palpitations. And then with PTSD, you can also have quite a lot of nightmares and flashbacks of the initial stressful event that triggered your PTSD. Social anxiety disorder is slightly more prevalent, affecting about 10% of adults, and PTSD affects about 5% of adults. So this gives a little bit more detail about the prevalence of these different types of anxiety disorders, and you can see that they tend to be suffered more by women than by men. So there is an increased prevalence of generalized anxiety disorder, panic disorder, and specific phobias in women compared to men. What you can also see is that the age of onset is actually quite young in a lot of these issues. So specific phobias can emerge as early as under 10, and then social anxiety and OCD, which is repetitive behavior syndrome, and they tend to appear in teenage years, and then panic disorders and and PTSD are often in your 20s, and generalized anxiety disorder is a little bit later. But on a whole, compared to some of the other disorders that we've been talking about, these mental health issues are emerging in people in their 20s and 30s, and it's the major problem really in people of those ages right now, and it's the major reason that people of those ages tend to use medicinal cannabis. So we'll start with what we know about cannabis, the whole plant cannabis, and the relief of anxiety. So we know we have strong anecdotal evidence that people use cannabis to reduce anxiety and improve mood. And in clinical trial data that has looked at cannabis use in a variety of different medical conditions, where issues such as anxiety and depression and mood have been measured as quality of life measures, these are often significantly improved by cannabis in these clinical trials, but not as the primary endpoint. They would be as secondary endpoints in these trials. And improvements in anxiety and depression and mood are often associated with improvements in sleep quality, and this highlights the interplay between sleep and mental health and physical health. However, THC itself, the molecule THC, can have both anxiogenic and anxiolytic effects. So anxiogenic means that it can promote anxiety, and this tends to be dose and frequency related. So the more and the higher dose of THC that is consumed and the more frequently it's consumed, the more likely that THC or high THC containing cannabis can actually cause anxiety within a person or a patient. This is a little bit like the epilepsy story, in that low dose THC can be anti-epileptic, but high dose THC can be pro-epileptic. But in terms of reducing anxiety, the compound that we know a lot more about, and the compound that we know is a lot better at kind of consistently reducing anxiety, is cannabidiol. So we have quite a lot of clinical trial literature on the use of cannabidiol in anxiety disorders. And I'm just going to separate this out into first the work that's been done in healthy volunteers, so these are not patients, and then the work that has been done in patients. So it started off really with some studies showing that if you gave an acute dose, so a single dose of CBD at either 300 or 600 milligrams to people who were doing a public speaking test, like standing here and giving a lecture in front of people, they found that CBD significantly reduced the anxiety ratings that people reported after doing a public speaking test. So this was really the first indication that CBD had an ability to reduce anxiety, but these were in healthy volunteers. And this is actually work that I've done personally. So we looked at whether or not there was also an effect on the hemodynamic response to stress. So that is your blood pressure and your heart rate response to stress. And the reason that we did this is that because it had been shown in animal work that CBD was able to reduce all of the cardiovascular parameters associated with stress. And so we followed this up in a healthy volunteer study, and we used a single dose of CBD as had been previously shown to be anxiolytic, and found that CBD significantly reduced both the resting blood pressure of our healthy volunteers and also the blood pressure response to stress. And that was either a physical stress that we asked them to perform, which was a hand grip exercise, or some mental stress tests where we asked them to perform maths. It's also so another study by the same group who actually initially did this work. They did a dose ranging study, and they found that 300 milligrams, but not 1 or 900 milligrams of CBD was effective at reducing anxiety. So we have a bit of an idea of the doses that are required, at least for a single dose of CBD. And we have several doses now that have been tested: 100, 300, 600, and 900 milligrams, and it's 300 and 600 milligrams that seem to consistently reduce anxiety. And then more work from my own laboratory. We followed up our study where we looked at that single dose of CBD being able to reduce the blood pressure response to stress. And we found that if we gave CBD to people every day for 7 days, that we didn't lose that response. So the CBD was still able to reduce the blood pressure response to acute physical stress after 7 days of treatment. So this is quite interesting because actually your blood pressure responses to stress is very important, and if you can keep your blood pressure lower, then that has a long-term beneficial effect on your heart and your cardiovascular system. But remember, these studies were all done in healthy volunteers, and they're not specifically in the relevant patient population that you would want to test. So if you would want to test whether or not CBD can reduce blood pressure in people who have cardiovascular risk, then you would need to perform those studies in people who have high blood pressure. But after the initial reports, and so some of these reports are maybe 10, 15 years old now, about the fact that CBD can reduce anxiety in healthy volunteers, researchers went on to look at whether or not this could be transferred into relevant patient populations. And so we do have a number now of small proof of concept randomized controlled trials where cannabidiol has been shown to be effective in different types of anxiety disorders. So the first study was in patients with generalized social anxiety. So this is where they feel anxious all the time over any kind of stressful situation. And again, what these investigators did was they asked these patients to do a public speaking test, which induces anxiety in these patients. And they found that if they gave either 300 or 600 milligram single dose of CBD, that it was able to reduce that anxiety caused by public speaking in these patients with generalized anxiety disorder. Then a follow-up study, this was carried out in Japan in teenagers with social anxiety disorders, so specifically having trouble with social interactions and social outings. They found that 4 weeks of treatment, now this is the first study that's looking at kind of chronic treatment with CBD, and that was 300 milligrams a day, was able to significantly reduce anxiety measures in these teenagers. So this was the first kind of treatment study that really showed that CBD can have a positive impact in patients with social anxiety. There's another study that looked at patients who were at high risk of psychosis, and they found they did an MRI study, so they looked at changes in their brain, and they found that when they gave these patients 600 milligrams of CBD, it partially normalized some of the changes in their brain function. So this was a study that was trying to show the mechanism of action and found that CBD could restore brain function to something that looked a little bit more like a healthy person rather than a patient in this study. And they also found, so the same group went on in the same kind of patient population, which are patients at high risk of developing psychosis, and found that 7 days treatment with CBD at 600 milligrams reduced their stress response to social stress, and it reduced the cortisol response, and cortisol is our stress hormone. It reduced the cortisol response to that social stress test. So this is all just, again, giving more evidence that CBD can reduce stress and anxiety in relevant patients. We talked about patients with Parkinson's disease in the last lecture, and there is a study that specifically looked at the anxiety within patients with Parkinson's disease. I mentioned that that was one of the symptoms of Parkinson's. And so this study was specifically designed to look at whether or not CBD could reduce the anxiety in patients with Parkinson's disease. And they did find that a single dose of CBD of 300 milligrams reduced the anxiety to a public speaking test. And lastly, in patients who have heroin use disorder, it was found that CBD, and they looked at either 400 or 800 milligrams, reduced the anxiety and the cortisol responses, so that's the stress hormone responses, to the presentation of a drug cue. So these people have drug disorders, and normally when they're presented with the drug cue, they will have heightened anxiety and stress responses, but CBD was able to reduce that. So they're all small trials, but they're all consistently showing the same kind of answer, that within a range of kind of 300 to 800 milligrams in either a single dose or repeated dose, that CBD is beneficial at reducing anxiety. So I'm just going to move on to PTSD, because often they are measured, it is a type of anxiety, and we do have some data with cannabis-based medicines in PTSD. There is a lot of evidence of anecdotal use, and this is both use for symptom relief, but also maybe that cannabis abuse disorders are more prevalent in patients who have PTSD, and patients who have PTSD are more likely to use cannabis just in general, both recreationally and not just medicinally. So there is one observational study, which it comes from the New Mexico Medical Cannabis Program, and they had 80 patients with PTSD, and they found that the patients reported a 75% reduction in their symptom score when they were using cannabis compared to when they were not using cannabis. So this is an observational study, and it is self-reported by the patients, and they have to remember how they were before they used cannabis. But you can see that overwhelmingly of this patient population who were already on a medical cannabis program, they found that it was beneficial for the reduction of their symptoms. But remember that I've mentioned that THC itself can have anxiogenic effects, so can increase anxiety. And there is also some data in PTSD that cannabis can actually cause greater symptoms, can actually increase the severity of trauma-related symptoms over time. And there are several studies that suggest this. So in terms of cannabis use where THC is contained, I think the dose and the frequency of THC is going to be quite important, and there is evidence of both a benefit but also a detrimental effect of cannabis in PTSD. So what about cannabidiol and PTSD? Do we have any better data with cannabidiol, which should not have that anxiogenic effect of the THC? So at this stage, we really only have observational case report and case series data on PTSD. So there's one case report of a young girl with PTSD who found that CBD treatment either at bedtime and during the day as needed was benefited her sleep quality and reduced her anxiety. So she used CBD at nighttime, 25 milligrams at nighttime to help her sleep, and then she used the sublingual spray during the day as required for anxiety. And this patient is reported to have to be doing much better on CBD treatment than she was before. There's also a case series. So remember, this is where you have a number of patients who report to a single clinic or a clinician who are treated the same way, and then the data is compared. And this is a case series of 11 PTSD patients who were treated with CBD with a variety of different doses, obviously titrated to whatever was effective for the particular patients. And this was an 8-week treatment protocol, and they found, the doctors involved in this found a significant improvement in anxiety and sleep quality within these patients, and specifically that they had the patients who exhibited nightmares because of their PTSD, that these nightmares were reduced.